Okay, perfect. So first off, I want to thank Nicole and everyone involved in this ECHO for giving me the opportunity to come and talk with everyone about the Coordinated Specialty Care for First Episode Psychosis programs here in Ohio. This is part of a broader outreach that we are doing in the state of Ohio, kind of an outreach campaign, an information campaign to hopefully spread the word a little bit more about the Coordinated Specialty Care for First Episode Psychosis programs here in Ohio. So I'm going to provide a little bit of background of for some of those programs, share some resources of where you can locate those programs, and hopefully some good information about coming in contact with individuals and making referrals to those programs. So, okay. So first and foremost, when we talk about Coordinated Specialty Care for First Episode Psychosis programs, the important thing that we highlight is that when individuals are able to find treatment and find the best and ideal type of treatment, obviously we recognize the benefits are there, right? And so with first episode psychosis and the programs that help those individuals, they can and do get better. There is lots of improvement. I have lots of examples, and if we have time today, I can certainly share some of those examples from our programming of where individuals are able to accomplish wonderful things and very impactful and meaningful things as part of their recovery efforts. And so kind of touches on those a little bit. A lot of it, a lot of experience is tied with school and education, where individuals are able to either finish school or start school, depending on where they are in their life's journey, but also looking at, excuse me, some of their relationships that they have with individuals and friendships, and sometimes it can be tied to their living situations, their living environment. So really positive changes, really positive. I hate using the word improvements, but there are those things that can really improve the individual's long-term outlook. And so with Coordinated Specialty Care for First Episode Psychosis, or what we call, and you might hear me say CSC for FEP, that's just a lot less words to say when we're talking about our programming. And so when we talk about referring individuals to these programs, the sooner the better. The sooner that we can get them linked in programming, the better the outcomes can be. And I want to preface that by saying that just because an individual, let's say, has been struggling, we always want to make the point to say that, yes, it is ideal for individuals to get involved in a CSC for FEP program as soon as possible, but it doesn't mean that someone who has been struggling or been dealing with mental health issues, dealing with psychosis for a long time, it doesn't mean that they can't recover, because they can. It's just the ideally being able to get them involved in treatment sooner, it definitely improves the long-term outcome, because a lot of what our programs do is very individualized. So it's the idea of working with someone, helping them to identify what their goals are, what they're wanting to work towards, what they're wanting to accomplish. And so it's very focused on each individual that is coming into the program. And it's an interprofessional team, and we'll talk about that. And so there's a lot of different opportunities for individuals to have contact with people that will help them in different areas or different aspects of their life. So it touched on this as well, but we have a lot of situations, especially when we're talking about work or school. A lot of individuals that are coming into a CSC for FEP program are going to be somewhere between the ages of about 16 to 24 for the most part. That's kind of our age gap in terms of when most individuals are coming in. And so a lot of individuals during that time are going through a lot. I mean, I think back to my 16 to 24 years, there was a lot happening in my life, a lot of kind of self-discovery, a lot of kind of understanding who I am and what I'm about, and who are my friends, and transitions of getting my own place to stay. And so a lot of the individuals that are coming into our CSC for FEP programs, they want those same things, right? They want friends, they want to figure out who they are, and you add the kind of the layer of their onset of psychosis, and obviously it makes things very challenging. And I think sometimes in mental health treatment, we become overly focused on the diagnosis or the symptoms, and while treating those is important, we also have to recognize that we have an individual that wants to go to school, that wants to live on their own. They want to get married and have a family, and all of those things that people during that age may want. It doesn't change for individuals when they come into the program. And so the ultimate goal is to try to help them, whatever those goals are, help walk alongside with them in accomplishing some of those goals. So this is a map of Ohio, obviously. And in here, the Ohio Department of Mental Health and Addiction Services, they support coordinated specialty care for first episode psychosis programs here in Ohio. Now, there are two main types of, or examples of programs. There's a program that we run here at Neomed through the BEST Center, the Best Practices in Schizophrenia Treatment Center. And that program is called FIRST. And then there's also a program that's run through the Ohio State University. And it is run through what is called the Epicenter, or the Early Psychosis Intervention Center at the Ohio State University. And so both the program at the BEST Center and the program at Ohio State provide training, consultation, and ongoing assistance for the CSC team statewide. And so these highlighted maps here, or the highlighted counties, I should say, in the map, this is where there are CSC for FEP programs located currently. And I look at this map and I think, wow, there's a lot there. But the more you look at it, there's more counties where there aren't programs, obviously. And so we certainly look at this as this is a good start. And we certainly want to continue to try to get to some of the communities and areas where there isn't currently a CSC for FEP program. So as I mentioned before, there's two main kind of groups of where programs are. They're either the FIRST program, which is through the BEST Center, which is the program that I am a consultant and trainer for. And then there is the program through the Epicenter, or Early Psychosis Intervention Center at Ohio State. Now, there is also a program at Ohio State. So while Dr. Nick Brightboard is the psychologist's name, he oversees the Epicenter at Ohio State, but they run a program through the university, at the university as well. So while there is a lot of partnership with community mental health agencies, when we talk about the Epicenter program, they also have a program that's located at the university. So here's a little bit of information about the FIRST program. So we currently have programming available in 23 counties in Ohio. And so just a little bit about the criteria for individuals to be eligible. So we are looking for individuals between the ages of 15 and 40, experiencing no more than 18 months of symptoms. This is whether they have been involved in treatment or not. Our program is specifically geared towards individuals that have a schizophrenia spectrum diagnosis. So we aren't currently serving individuals that have affective psychosis, so bipolar with psychotic features, major depression with psychotic features. Those aren't currently acceptable diagnoses for enrollment in the program. And we'll talk about the treatment modalities, but individuals must participate in at least 2 of the 5 treatment modalities that we'll talk about here in a second. So there's a couple of things, and I almost preface this by saying with individuals, it's not appropriate for individuals who are experiencing these, because oftentimes our teams will work with individuals if there is some question as to, okay, was the symptoms the individual experienced due to substance use or not? Because we know that there's a huge co-occurring issues for individuals along with psychosis, one of those being substance use as well. And so oftentimes our teams will work with individuals to try to hope to get some more clarity as to whether or not it was a substance-induced situation or not. And then part of the intellectual disability, our program is a manualized program. So there are materials that are reviewed with each of the participants. And so sometimes there might be individuals that the team has to kind of talk about, okay, could the individual understand what we're talking about? Are they able to comprehend the materials? And sometimes teams have had to take different approaches. So maybe it's not, hey, here are some handouts we're going to talk about. Sometimes it might just be kind of verbally going through some of the information with the participant. And so I encourage, whenever I'm doing a presentation in the community, I encourage the participants to don't get fixated on trying to determine whether or not, okay, is this person appropriate or not? Refer the individual to the agency or to the team and allow them to kind of work through that a little bit, and they can determine what would be the most appropriate form of treatment for the individual, whether it's a CSC for FEP program or something other. So here are the treatment services that make up the first program. So there's individual resiliency training. So that is individual therapy or counseling. There's supported employment and education, medication management, family education and support, case management. And then many of our first programs also have begun to offer peer support services. And I know that a lot of our teams have plans to continue, or not to continue, but to add that service onto the team as well. I am a big believer in peer support services. The teams that have peers currently have really found it to be a wonderful addition to the teams. It's a valuable voice that is very necessary for a lot of our CSC for FEP teams. So here's some information regarding the Early Psychosis Intervention Center program, or Epicenter program, from The Ohio State University. So their criteria is a little bit different in terms of what they are looking for, some similarities, but their age criteria is a little bit different, and they do work with individuals that have experienced affective psychosis, so mood disorders with psychotic features. So individuals that have been diagnosed with bipolar with psychotic features and those types of diagnoses. Very similar in terms of some of the programs or the treatment services that are offered. There are a couple of differences. They offer some metacognitive remediation therapy as part of their program as well. But again, for the most part, there are those core, kind of quote unquote, core services that are available for both programs, whether it be supported employment therapy, medication management, case management, family education. Those are kind of the core services that are available when we talk about CSC for FEP programs. Now, the program that is specifically at The Ohio State University, so this is located at the Wexner Medical Center, and they provide the services there at the university. So it's got more of an academic feel to it as well. Their criteria is a little bit different specific to that program in terms of their onset. So most of the other programs are looking at 18 months, 2 years. His program that Dr. Brightboard does at Ohio State is looking within 5 years. So in terms of the illness onset, so there is a little bit different criteria for the program that's specifically at the Ohio State University. And these are the services. He is, like I said, the program is located at Ohio State, and so he has a lot of different programs and services that he's able to incorporate because it's at a university. I think this also highlights some of the challenges that can happen when you're talking about a program that's run at a world-renowned university and a community mental health agency. Obviously, community mental health agencies, most are not going to have the resources to be able to offer all of these treatment services, unfortunately. I think it would be wonderful if they could, but it's just not always going to happen. And so he has a lot more resources there at the university in terms of being able to serve individuals that are able to come in. the last couple of slides here, just wanted to share some examples of positive treatment experiences individuals have had as part of being enrolled in a CSC for FEP program. Here's an individual that he was able to complete a barber training program on a scholarship, and sort of being involved in that, the program helping him to link with that, helping him to establish and improve his relationships and develop those supports in his life, be it family or friends, certainly was a benefit for this individual as well. This is a quote from a mom of an individual, a participant in one of the CSC for FEP programs. And I tell you that I think a lot of family involvement, we certainly do for all of the CSC for FEP programs, family involvement, loved ones, however the participant defines their family, but having them involved is huge. It really helps the participant, it helps the families to understand a little bit more about what's going on, understanding the process of recovery, gaining some insight as to how they can assist their loved one in terms of kind of working through maybe symptoms that they might experience. And so very, very powerful quotes. As I shared with you, there's a lot of examples. I'm very mindful not to call them success stories because, I think most individuals that come into the CSC for FEP program have really positive treatment experiences, and they have things that they're able to accomplish. We don't always have to get fixated on, and they're kind of the ones that are out and about in the world where individuals experience psychosis and they accomplish great things. They become attorneys, or they become doctors, or they, become all of these things. And those are great stories. But I think for a lot of individuals, the things that they accomplish are just as impactful and meaningful for them, be it that they become a peer support, be it that they become a barber. All of those are powerful examples and powerful situations, and the benefits of getting individuals enrolled in treatment as soon as possible. So here's the map again. And also there's a website for those of you that are interested. I believe Sandy put them in there in the chat box. So there's a couple of links there where it will take you directly to where the CSC for FEP programs are located here in Ohio. So it'll take you to a listing. It'll go by county, what the agency is and who the contact person is at that agency to be able to refer individuals to the program. And like I mentioned earlier, if you come into contact with an individual, don't feel like you have to determine if the individual is appropriate or not. If you think, okay, there might be something here, because there's been circumstances where individuals get referred to the CSC for FEP program and they determine not to be appropriate for the first or for the CSC for FEP program, but they're still able to get transitioned to the service that they need or the treatment that they need. And so it might not be specific to this program, but they're still getting engaged in treatment, which I think we can all agree is really what we're trying to do. When individuals could benefit from treatment, however we can make that happen, I think is a step in the right direction. And then I believe the last slide here, is the kind of the same website, just on a different slide here. So I want to go ahead and stop my share. I certainly want to open it up if we have